Candida auris mostly affects patients with severe underlying medical conditions that require complex medical care, because these conditions can weaken the patient's immune response and lessen their ability to combat infection. Patients with invasive medical devices like breathing tubes, feeding tubes, catheters in a vein, or urinary catheters are at increased risk for developing an infection with Candida auris. While invasive devices are necessary tools to treat patients who are ill, they can also provide a route for germs to enter the body by creating an unnatural way to bypass the body's defenses. Germs can enter the body during insertion of the device or during device maintenance. So, ensure that devices are placed safely, like using aseptic technique when inserting an indwelling urinary catheter, and follow diligent infection control practices during maintenance and handling of devices. Assess the need for invasive devices daily and remove them when they are no longer needed. Individuals who have had frequent hospital stays or who live in nursing homes are also at a higher risk of Candida auris transmission. In general, Candida auris poses a very low threat to individuals in good health. This includes healthcare workers who care for Candida auris patients and family members of those patients who have no known risk factors. Individuals with a healthy immune system can more effectively fight off Candida auris and other pathogens. The Centers for Disease Control and Prevention advises against screening healthcare workers for Candida auris. Instead, adhering to recommended infection control measures, like barrier precautions such as gowning and gloving, and proper hand hygiene, can prevent transmission to healthcare workers. In fact, one research study that tested healthcare workers in a facility with the Candida auris outbreak found that staff rarely became colonized, and the few who did cleared it quickly. The CDC typically does not recommend screening or testing for family members either. Family members should be educated on the importance of hand hygiene compliance at home and when visiting a healthcare facility. They do not need to wear gloves or gowns for regular interactions with the patient with Candida auris. Even immunocompromised family members are at low risk of infection with Candida auris if they are living in a private home. However, caregivers and family members caring for a person colonized with Candida auris should perform hand hygiene before and after providing care or touching medical equipment and devices. And they should consider wearing gloves if they are going to have contact with the person's body fluids, including blood, stool, urine, and vomit. The person colonized with Candida auris should also frequently perform hand hygiene. Here are some key points to remember. In general, Candida auris poses a low threat to individuals in good health, including healthcare workers and family members without other risk factors. Screening is not recommended for healthcare workers during healthcare outbreaks of Candida auris. When caring for persons colonized with Candida auris at home, hand hygiene is needed before providing care and after providing care to reduce the risk of spreading Candida auris. Thank you for listening today. This video is part of a 10-part video series on Candida auris. To access additional videos, please visit the Candida auris video webpage at health.pa.gov/c-auris-video. For questions about Candida auris, please contact your local health department or call 1-877-PA-HEALTH.